We're all good. Kia ora koutou, my name is Nick Barclay and I'm the Deputy Lead for the All of Government Communications team working on the COVID-19 response. From today you'll start to see change for these daily stand-ups. As you can see, we have some different banners that reflect the new campaign that was launched by the Minister of Health and the Associate Minister of Health this morning, with new website and social media channels as well. We'll be continuing to work alongside the Ministry of Health to support these stand-ups, and we'll be including some different voices from across government to provide some updates for you. Alongside Dr. Ashley Bloomfield, Director General of Health, today we have Iona Holstead, Secretary for Education, following the case in Dunedin yesterday. I'll now hand over to Ashley and then to Iona before we take the questions.
Kia ora koutou katoa and welcome again to the update today. New Zealand has 8 new cases of COVID-19, all overseas travel related. There are 4 new cases in Auckland, 1 in Christchurch, 2 in Waikato and 1 in Invercargill. This brings our total to 20 confirmed cases in New Zealand. Now, I don't have all the details yet because some of those results just came through this morning and it would take too long to run through all the details today at this stand-up. However, the details for each of these cases, including flight information where applicable, will be on the Ministry of Health website as it becomes available in the near future. As I've said at earlier stand-ups, for a couple of weeks now, we expected more cases, and it's most important that we identify, that we test and isolate cases and close contacts to ensure that we prevent further community spread. The clear link to recent overseas travel for these 8 cases reinforces the border restrictions that were implemented this last weekend. These restrictions are not retrospective, but I urge others who have arrived earlier from overseas to voluntarily self-isolate and, of course, be aware of what symptoms could be of COVID-19 and that they should ring Healthline or call ahead to their general practitioner for testing if they think that is warranted and to get advice. Contact tracing will be underway on any relevant flights for those new cases. And as I have said over the last 2 days, that covers the 2 seats in all directions, to the front, to the back, to the side and diagonally. Healthline will also be provided with the seat numbers and will rapidly be able to advise anyone on the flight whether they are considered a close contact. Just to reiterate again, we want to find cases. If we find them, then we can put in place appropriate isolation, contact tracing and prevent community spread. That is the game we are in. Turning now to the school closure in Dunedin. And this is the high school that is linked to the 12th positive case. Logan Park High School is working closely with both education staff and public health officials. The school was initially closed for 48 hours while close contacts are traced and put in self-isolation and monitored by health officials daily. There are around 150 close contacts. After discussion and consideration this morning with the Prime Minister's Chief Science Advisor, the Ministry's Chief Science Advisor and the local Medical Officer of Health, and because this is the first positive case within a school, we have decided, in addition to the self-isolation, that these close contacts will be tested over the next 24 hours to ensure that there are no other positive cases. This is a unique situation and it is part of our precautionary approach that we have taken all along with our response to COVID-19. So all close contacts will be tested and we won't have those tests all back until Friday. So we are closing the school, we're advising the school to close now through till after the weekend, and it will only reopen once we have the results of those testing, and that will be by later in the week. All those close contacts will still be required to self-isolate for 14 days because it may be that one or more of the students could be incubating the virus and we will be watching them for the development of symptoms. The police has conducted some compliance visits yesterday on a random sample of travellers who arrived in New Zealand since the self-isolation requirements came into place at midnight on Sunday. The Ministry of Health requested police to conduct these visits, and approximately 50 individuals were visited throughout the country. And they involved police visually citing those people who were expected to be in self-isolation and asking a series of questions relating to their well-being while self-isolating. They made contact with 41 individuals yesterday, and another 3 people are being followed up today because they could not be reached at the time. More visits will be conducted, and both the police and, of course, ourselves are very pleased with the high level of compliance. It was clear with people taking this self-isolation requirement seriously. And we must all take it seriously. This will be fundamental to our ability to prevent community transmission. And I'm very pleased that New Zealanders see the importance of this and are supporting our broader efforts. Regarding influenza vaccination, announced earlier today was the early start of our annual influenza vaccination campaign, and an increase in the number of vaccines available, an extra 400,000 than were administered last year. That's a 30% increase on last year. It is particularly important that we protect those who are most likely to be hospitalised if they get influenza, that is those over 65 and people with pre-existing conditions. And those are the groups that we will be prioritising over the next 4 weeks to receive those vaccines. As the Minister said this morning, it's critical we do what we can to prevent a bad flu season, as the flu can cause a significant strain on our health system, and more people being vaccinated against flu will help ensure that we relieve that pressure on the system. We know, of course, that the flu vaccine does not protect against COVID-19, but it will help our overall efforts to manage and respond to COVID-19. I should also reiterate that people not in those priority groups, and also that includes young children with a history of severe respiratory illness, will not be able to be vaccinated until after the 13th of April. And I believe all New Zealanders will understand why we want to put our efforts into ensuring we get those highest priority groups vaccinated over the next month before widening access to the vaccine subsequently. I'd now like to hand over to Iona to talk a little bit more from an education perspective.
Good afternoon. Can I start by thanking the school and the school community in Dunedin for how they are managing this event. I am a grandparent too, and I have children in primary, secondary and tertiary institutions, and I understand why people might be anxious. But I do want to assure everybody that what has happened in Dunedin has been, we've responded with a plan. The plan was there for this eventuality, and the plan is in place, and it's working. And I also want to be clear that we are not currently expecting or planning for widespread school closures. We are planning for temporary closures, as is happening at Logan Park. But as the World Health Organisation confirmed, the risk to children remains low, and parents should continue to send their kids to school and early learning services, unless, of course, they are unwell, in which case it's very important they don't attend. However, part of our planning is still important that schools and early learning services continue to prepare for distance education, not necessarily because of closures, but because of self-isolation over a 14-day period. And we are talking with major telcos at the moment on a cross-industry response so we can support those students with limited or no connectivity at home. And again, we have planned for this and are able to respond. We're working closely with our health colleagues and other government agencies to make sure that schools and their communities are kept up with information as it changes, quite frequently changes, so it's hard for them to keep up. So we're doing daily messaging to schools and early learning services. Happy to take questions.
Iona Hoskin, in terms of the reaction for schools, are you considering, or under what circumstances would you consider bringing forward the April school holidays?
It's not a matter of consideration at the moment because we're not planning to close schools. We're planning to, well, the Ministry of Health, of course, closes schools, and they will do so when there's an event that requires the school to close.
Despite the school closing, there was a huge party last night, hundreds of students gathering in close quarters. Any advice for Dunedin students in particular?
I'm not sure that I can give them any advice that's going to work now. That would have to be before the party. The issue, it's a good point though, because closing schools doesn't stop people meeting. And so there's quite a reaction from parts of the community saying close schools and children will be safer. Actually, they won't be any more safer. They will still be doing the things they would have done in school.
In terms of these new 8 cases, are there any other schools that are at risk or that we know of that you're looking into?
Based on the information I have at the moment, there are no other schools that might be involved. However, as we get updated information, some of these cases we've just got the information through this morning, that will be on our website, and we will of course work with any schools that may be involved. Perhaps just a further comment on the question that was just asked. I think the party was university students last night in Dunedin, a St Patrick's Day gathering outside. We need to take mass gatherings seriously, and this is something we've given further advice to Cabinet, and they are considering that. The special Cabinet CVD committee is considering that again this afternoon. Stopping mass gatherings will be a really important part, we have seen that from overseas, of preventing onward community transmission, and of course that requires everyone to do their bit. So look for further advice potentially on this later today or tomorrow.
On mass gatherings, Destiny Church is still planning to go ahead with their service on Sunday. Have you got any kind of advice on what the government might be able to do about that?
Well, I imagine that the Destiny Church will be wanting to reduce the risk to their own members and the wider community of any transmission, and I expect that they, like all New Zealanders, will be looking at this advice as it comes through later today and responding appropriately.
The Australians are banning gatherings of more than 100 people. Are we looking at moving in that direction?
We're looking very carefully at that.
Ashley, what are the nationalities of the people that have come in, the new cases of the virus in the country?
My understanding is that these are all Kiwis who have returned from overseas. As you can imagine, once travel restrictions started to be put in place by a whole range of countries around the world, it became much harder to travel. And so many people were wanting to get back, not to beat the deadline of midnight Sunday, but just to get back home before they would have found it more difficult to travel. And so these are all Kiwis who were returning home, as far as I'm aware.
Have all of them been in self-isolation, or have some of them entered before the deadline and have been moving around the community?
All the ones that I know about and have detail on to date had been in self-isolation, and so that's something I do want to point out. People understand the expectation. Not only were they in self-isolation, the ones I have detail on, but they were aware of the symptoms and did the right thing when they became symptomatic. So again, I want to reinforce the importance of that and commend those who did do this.
So these 8 new cases, were they all part of the big impact, sort of ramp up of the 500 tests yesterday?
They were all detected yesterday, and in fact, yesterday there were 620 tests processed around the country, and we have these 8 cases, plus the 9th being the boy in Dunedin that were identified through the testing yesterday. Just to reiterate the point I made yesterday, and it's a point made very eloquently by Susie Wiles in her column today, with a very nice diagram of who should be tested. It is important we test the right people, and by testing the right people we will find cases and then we can act accordingly.
So is this not proof of if you're testing more people you're likely to catch more cases, which has been a criticism in the past, or is this now because people are returning from overseas they are more likely to have COVID-19?
Correct on the latter point. So we've got more people coming from overseas who have come from areas where there is COVID-19 transmission in the community. You'll have heard the WHO Director General a few days ago describe Europe as the new global hotspot. Some of these people have come from Europe, some from Australia and some from the USA. So they have come out of places where there is wider transmission of COVID-19, and this is exactly as we would expect. And so that's why we are testing to find these people and then respond accordingly.
Actually, sorry, do you have any idea of the numbers of New Zealanders returning home from those areas?
We were getting that information. What I can say is the numbers are declining very quickly because travel is declining quickly. But we will have those numbers, perhaps of the number of who have entered the country over the last few days, and just to show what those numbers are.
Can I clarify? 40 people that were visited yesterday by police.
Yes.
How many of those were foreign tourists?
I don't have that information.
Do we know what's happened to when you have 2 Southeast Asian tourists who are in forced isolation? Who's holding them, and when are they going to be deported? What's happening with them?
Actually, it's customs, immigration and police who are dealing with that, so I don't have the details on that, but we can get that information.
Have any other tourists been placed in isolation and forced isolation?
Not as far as I know, but what, of course, is clear, tourists are very clear about what the expectation is of them, and now as they come into the country, health officials are requiring them to show evidence that they have very firm plans for self-isolation when they arrive.
Given these new 8 cases, has the risk of community outbreak risen from low, or do you still think of that as low?
I think that we have no evidence at the moment of community outbreak, and our border restrictions are intended to keep that risk low. It is something we are very, very alert for, and that is why we're wanting to do sufficient testing so that we can detect any evidence of community outbreak and then respond accordingly.
But do you think the risk is still low?
At the moment, it appears to be low, but we're assessing it on a regular basis.
We have a Canterbury GP telling News Hub that they're having trouble sourcing COVID-19 swab tests. Are we having supply issues at the moment?
We have actually 30,000 swabs in the country at the moment, and what we are doing is making sure those are distributed around the country, and we've got work underway. Our Chief Medical Officer convened all the labs on a teleconference 2 days ago to address this very issue, so we're making sure that there are swabs wherever they are needed around the country.
On equipment, does the Ministry have any idea how many ventilators there are currently in the country?
I don't have the number in my head, but we are absolutely collecting that information. So we have ventilators in our intensive care units, and of course ventilators in our theatres, and sometimes in our post-operative areas. All of these are potentially able to be used. Those are the ones we have at the moment. However, of course, the ventilator is only useful if you have someone trained to be able to look after a person who's being ventilated.
But there is no existing database for this. You're having to do this now as part of the pandemic planning.
Yes, because we have quite a distributed model of healthcare in New Zealand with district health boards. However, believe me, our district health boards are working incredibly closely with us, and I'm in regular contact with the chief executives. They all have very clear plans, and we have got a really good idea now of not just the numbers, but where they are distributed, and importantly, how we can utilise all those ventilators should they be needed.
Is this a wide audit as well of all equipment, such as beds? Is that what's being counted as well?
We know where all beds are in our hospitals. However, the important thing here is knowing where we can flex up capability if we need to. And one of the best ways we do that is by, for example, stopping elective surgery if and when we need to. We also have already reached out to the private sector, and they are doing a sweep of all the private sector hospitals to look at what ICU or high dependency unit capacity they have, what ventilators they have, and what beds they have. So we will be looking at both public and private sector as part of our overall health system capacity.
Are you worried about ICU bed rate? ICU per 100k was 4 or 5 in New Zealand. Italy had 12.5. Obviously a very different population. But are you worried when you get that rate up?
What I'm concerned about is ensuring that we take the appropriate actions here to ensure that our health system can cope. And that is why we have, right from the start, taken a precautionary approach, acted early and gone quite hard on things, and we're going to continue to do that. The important thing here is that we ensure our health system is able to manage whatever level of COVID-19 cases we have here, and we need to make sure that peak doesn't exceed our health system capacity, even after we've put in place other processes like increasing our ICU and ventilator capability.
The World Health Organization says people shouldn't be using non-steroidal anti-inflammatory drugs like ibuprofen. Do you have any concerns about that within the Ministry of Health?
I don't have a concern specifically about that. If that is advice around that relates specifically to COVID-19, what they're probably saying is that paracetamol is better because sometimes if you use non-steroidal anti-inflammatories like ibuprofen, they can have side effects, particularly in older people, whereas paracetamol doesn't have that same side effect. It causes irritation in the stomach, which can be not very good, particularly for older people.
On clinical assessment centres, where are they going to be and how many are there going to be?
It varies by region. So if I think about Auckland, for example, they're going to start with 5 across the Auckland region and then scale up as they need to there. So each district health board will be determining exactly how many they need and where they will be, and we're expecting those to be finalised with this week, and then it will be clear to the community about where those are and how to access them. What I will say though is these are not places that people will be expected to rock up to if they think they've got COVID-19. The appropriate process is to ring Healthline. They will refer people if they need to be tested.
Will you be advising the government to ramp up border controls?
Well, our border controls are already quite strict. I know Australia has made subsequently even stricter border controls are put in place, and I know that the government will be looking very seriously what Australia is doing. So I'm sure we will. That's a live issue. We haven't provided further advice at the moment, but I'm sure it will be a discussion.
Does the ministry have any modelling advice that shows that community transmission is likely to start early next month and peak in August?
So, if you think about this as a single wave of transmission, you can model it, and all the models show, yes, that's what will happen. What we do have the benefit here is of some more recent modelling, and we've got a paper that just came through overnight to the Prime Minister's Chief Science Advisor that looks not so much at the modelling, but at what you can do to prevent that big peak. Now, what we have to date been talking about is flattening the peak. But even if you do that, you still likely exceed your health system capacity. So therefore, our approach, and this is what successful countries have been doing, is in a sense you want to have a series of small peaks over a longer period of time, and you amplify up quite stringent controls to ensure that you don't exceed your health system capacity, and then as it goes down again, you can ease those and be prepared to ramp them up again. So this is what looks like to be the most successful strategy. What we have been able to do in New Zealand is buy ourselves time to look at what is successful and then apply the right interventions at the right time.
So with that peak, have we seen that peak yet? What's the latest?
No, we haven't seen that peak yet.
When can we see that peak?
Well, what we're doing is watching very closely. The challenge here, and it's one I think we've risen to really well, is you need to think about what is it we think we might need to do in 2 weeks' time, and you do it now. So we're constantly thinking ahead. We've got excellent technical advice. We've got great overseas links, and we're looking to see what has been successful in other countries so we can apply it early and ramp it right up here in New Zealand. Final question, please.
What will happen if we have a huge surge in people needing flu vaccinations, and do we have enough scientists testing for COVID-19?
That's 2 questions. I'll take the first one. I anticipate there will be a strong interest in flu vaccination this year. Fortunately, we have 30% more than we had last year. We are really keen to vaccinate as many people as possible. Our priorities are the people who are most likely to suffer severe impacts of influenza and be hospitalised, so over 65s and those with pre-existing conditions, our health professionals and our frontline workers, and that's where we will be prioritising vaccination over the next month. Thank you very much for your interest and for your support.
Do clinics have those vaccinations now?
Yes, the vaccines have gone.
A few more questions about the school community, if you have.
Please, if she's willing to.
What should do you have any advice for what like ECD, school or university community could do if someone within their community is still waiting for test results?
I think that's a health question.
That is a health one? Okay.
Can I ask with your chats with telecom providers, can you detail that kind of support that you're looking at? Can you be specific? Are we talking about more tablets, computers, or...?
In terms of the online environment, we will have to have bimodal support for teachers, because we do know there's areas where there's not connectivity, but connectivity is the first issue. And so we're working with telcos to see whether or not we can extend connectivity. And that's got some constraints to it, just the numbers of cell towers and things. So we're trying to maximise that and also prioritise where they are. So early stages, but all of the industry is working closely with us and other parts of government. So we don't get to the issue of devices really until you've got connectivity.
Is devices something you are thinking about?
Oh, certainly. We've just done, as you might have seen in the media, that we've done a survey of schools, we've talked to all the schools, and part of that was to find out the numbers of devices they did have and the numbers of kids who didn't have them. But as I say, we will go bimodal, and particularly for the 0 to 8-year-olds, it's probably better to be hard copy anyway.
How many days did the Dunedin student attend school after their parent arrived back from overseas?
Sneaky additional question there. So the student who's at Logan Park became symptomatic over the weekend and attended on the Monday. That's when his father got the test result back. He let the student know, who then went home.
We're going to finish up here. The
very much.
release will have the contact details for any other questions you want to follow up.
Thank you very much again.
Thanks, guys.